Good afternoon, and welcome to the lobby of the House of Assembly, the People's House. It's great to see the turnout, and we have some special guests and some really interesting news and announcements to share. So without further ado, what I'm going to do is hand the podium over to our Premier, Dr. Andrew Furey. Premier.
Thanks, Minister. Certainly, I'm not sick of saying good to see people in person again. Announcements in person are certainly more pleasant than those on a screen. So thank you all for joining us here today. We know, and I've never shied away from the fact that our healthcare system is struggling. It's struggling here in Newfoundland and Labrador, and every community and across our beautiful province is equally struggling across the country. And as we emerge from this pandemic, we're handed a generational opportunity to redefine and reinvent a Canadian healthcare system that really hasn't changed significantly for 40 or 50 years. But specifically, with respect to Newfoundland and Labrador, we know that our province, unfortunately, has the highest rate of cardiovascular disease, and we know the impact on individuals who are waiting for that crucial cardiac care. We know the anxiety that causes with them as patients. We know the anxiety it causes with their families. And equally, we know the anxiety that it causes with healthcare professionals who are their advocates in trying to get them done. So reducing wait lists is a priority, should be a priority, and is a priority for all of us. So today I'm pleased to announce an agreement has been reached on a memorandum of understanding between Eastern Health and the University of Ottawa's Heart Institute. This agreement will reduce the cardiac wait list and help build on the strength of our existing provincial program. Eastern Health has a long-standing relationship with the Ottawa Heart Institute, and this represents the next best step. They've been working together for many years to facilitate access to complex cardiac cases and procedures like heart transplants for Newfoundlanders and Labradorians. This MOU will formalize the partnership and create an official affiliation between these two great organizations. The partnership between Eastern Health and the Ottawa Heart Institute is a unique example of interprovincial partnerships working together to advance cardiac care and patient care to drive better health outcomes for all Canadians. It is, hopefully, a temporary strategy all about providing quality health care to Newfoundlanders and Labradorians and alleviating the pressures exacerbated by the long pandemic and, unfortunately, the cyber attack this past fall. So, my friends, this is good news for the people of this province. It means that in the short term, people needing life-saving cardiac surgery will have their wait time shortened. The wait will be shortened in one of two ways, either by Ottawa surgeons operating here in our province alongside our world-class cardiac surgeons, cardiologists, perfusionists, and nurses who work so diligently to continue to provide the cardiac services to everybody in this province, or depending on the patient's needs and circumstances, the patient may travel to Ottawa to the Heart Institute itself. It's important to remember that we have world-class cardiac care right here in Newfoundland and Labrador. And not only in our surgeons, but as I mentioned before, in our nurses and our cardiologists and our diagnostics, we just need a little bit of help right now. Additionally, this MOU will allow for continued professional exchange and opportunities between the partners. I promise you, every one of you, that we are working to reduce wait times for all surgeries, not just cardiac surgeries, of course. Orthopedic surgeries are particularly important as well. Today's announcement is just the beginning, and it builds on our ongoing work to improve access for all Newfoundlanders and Labradorians. Last week, of course, after meeting with the Newfoundland and Labrador Medical Association, we established a task force to look at the surgical backlogs and provide meaningful, collaborative solutions. This is all in keeping with our government's commitment to change the delivery of healthcare in our province for the better, to not continue to invest in the old paradigms of the past, to not let this opportunity of disruption slip through our fingers and revert and regress to the mean, but indeed to reinvent and reimagine a new, sustainable, modern healthcare system for the people of Newfoundland and Labrador. Most importantly, though, we know that we have the dedicated, hard-working, compassionate healthcare professionals the best I've ever worked with anywhere, here in our own province, who are dedicated to continue to look after the patients and lead that change. I'd like to thank Mr. David Diamond and his team at Eastern Health, including Clinical Chief of Cardiac Care, Dr. Sean Connors, alongside with Dr. Mesana and Ruel of the Ottawa Heart Institute, who we're so happy to be here today. And of course, the hard work of our dedicated people at the Department of Health. My friends, the Department of Health is not an army of people like you may all think. They have been tried and tested, in particular in the last year with the pandemic, and then as we were coming out of that, little relief, the cyber attack. These people are truly heroes who are working in the halls of the Confederation building on your behalf, and they deserve the acknowledgement on behalf of all of Newfoundlanders and Labradorians. So with that, I'll turn it back to you, Minister Haggie. Thank you very much.
Thank you, Premier. I'll now turn the podium over to someone who, whilst I will introduce him, probably needs little introduction. He's a face we see from time to time. Mr. David Diamond is the President and Chief Executive Officer of Eastern Regional Health Authority. David.
Thank you very much, Minister Haggie. I think the fact that you see my face as often is reflective of the challenges in the last couple of years that the Premier has spoken about. Good afternoon and thanks. What an exciting day to be here. I'm just delighted to be here to participate in this announcement with the Premier and especially our colleagues from the University of Ottawa Heart Institute who've traveled here overnight for this event. Also want to thank many other guests that are here. In particular, one of our board members, Sharon Forsey, is here, and Dorothy Senior, I think one of our Patient Advisory Council members, are here in the audience. So thank you to you for being here, all of you. Since the start of 2020, as the Premier has already alluded to, we've, like other organizations everywhere in the country and in the world really, we've experienced these unprecedented challenges in the healthcare system. And as an organization, we've been able to pivot and address any number of issues that we've faced as a result of these events, while also providing care to our patients, our clients, and our residents. And that's been no easy feat, and in large part a testament to the hard work of frontline staff and our physicians. Eastern Health has always been open to working collaboratively with other organizations. In fact, we pride ourselves on building partnerships that will improve the health outcomes for the people of the province. This approach has served us well as we worked our way through the last 2 years, that's for sure. Building strategic partnerships makes organizations stronger, and that's no different for a healthcare organization like Eastern Health as it is for others. Eastern Health has a long and strong partnership working closely with the Heart Institute to provide access to complex cardiac care such as heart transplant. This announcement today formalizes the clinical and organizational partnership and creates an official affiliation between us. As we've outlined in our strategic plan, we work always to improve access to care and to deliver tertiary care services such as cardiac care more equitably and more efficiently. By working with Canada's most distinguished centre for cardiac care, and that is the Ottawa Heart Institute, it's a world-class centre of excellence. We're able to deliver continue to deliver high-quality care for our patients. We have a small number of highly skilled cardiac surgeons and other staff, as the Premier has already talked about. And this partnership that we have with the Heart Institute provides our surgeons and our other staff where it provides an environment where they can continue to thrive and to do the excellent work that they're doing as our in-house team. In fact, this partnership has already helped us fill vacancies in our cardiac surgery program. Recruitment and retention is often challenging, but the close professional relationship that we've been able to build with the Heart Institute has resulted in surgeons seeing the value of working right here in this province. And we've recruited 3 very skilled surgeons over the last period of time, and we think that's a very direct result, one of the early very direct results of this relationship that we've built with the Heart Institute. 2 are already here. We have a 3rd who's scheduled to start working with us in July. By formalizing this arrangement, the Heart Institute surgeons will visit here on a monthly basis, just about, to perform surgeries. And this will help us address the wait lists. We've already talked about that we have in the province for cardiac surgery. And depending on the situation, some of our Newfoundland patients actually might also have opportunity to travel to Ottawa to take advantage of some capacity there. And we're excited about that as a temporary measure to try and bring down the backlog that we are facing at this point post-pandemic. In all situations, members of the entire heart team from both the Heart Institute and from Eastern Health will collaborate and work collectively together, virtually and in person. As well, our partnership provides considerable professional exchange and opportunities for our surgeons, which includes care planning, participation in academic and professional development opportunities, mentorship and proctoring in new processes and techniques, and things like minimally invasive surgical techniques. We're very pleased to support this enhanced level of partnership, which is good news for our patients. It's an example of Eastern Health's commitment to developing innovative partnerships so that our patients, our clients, and our residents receive the highest possible care. We thank the University of Ottawa Heart Institute for working with us. What a great relationship we've built already. These are first-class people. These are not only first-class clinical people, but folks who are share the passion that we have for high-quality care for the people in the country, for cardiac patients in the country, which includes our own folks from Newfoundland and Labrador. So we're very pleased with the relationship we've built and for the exemplary care that they're already providing to Newfoundlanders and Labradorians as a result of this partnership. Thank you very much, and thank you all for joining us this morning.
Thank you, Dave. I'll hand the podium over shortly to Dr. Thierry Mesana, who is the President and Chief Executive Officer of the University of Ottawa Heart Institute. Under his leadership, he has built up the centre, the Institute, not only to be our go-to resource and centre of expertise, but also Canada's go-to centre for cardiac surgical expertise. Dr. Mesana?
Well, thank you very much. It's a great pleasure to be here. Of course, I have not been a lot in Newfoundland in the past, but I really enjoy so much this place. The people are so nice and welcoming, and the history of the Newfoundland with the Heart Institute is not new. We have been actually Premier Furey referred. How he knew, he's a surgeon, but he knew very well Dr. Keon, who was the founder of the Heart Institute in the 70s. So the Heart Institute actually had only 3 CEOs since the inception. It has become gradually the biggest heart center in Canada, in particular since the last expansion in 2018. And I think we always have seen patients coming from Newfoundland, and they required our help. And I think my surgical colleagues and myself, historically, we have been providing this service to Newfoundland. But what Dr. Ruel, the current head of cardiac surgery at the Heart Institute, has done is one step above this. He has come here to support the team here, and I think it's very important. So I think we should continue to do this, to support the program and to support the community here. I think there is a lot of common points, actually, between Ottawa and here. Ottawa has been built by Dr. Keon Premier Furey, as you know, based on the community belief that a Heart Institute could be built in Ottawa. It's not Toronto, it's not Montreal, but it's the biggest heart center in Canada. So there was a will of someone at the beginning who wanted to do this, and we have continued the effort. I think it's the next step for the Heart Institute to collaborate with Newfoundland, and we're very proud of this. I think this is great for the community. There's a lot of cardiac patients who need a world-class service, and I think the world-class service can be delivered here. And that's the final goal. The final goal is to have a program which is affiliated. The two program will be affiliated, and then basically, if you're a patient in Newfoundland, you can have world-class surgery here, the same way as you would have it in Ottawa. That's the spirit of the agreement. As I say, finally the goal is that the Ottawa Heart Institute is not just Ottawa Heart Institute, it's Canada's Heart Institute. I'm not saying we're going to take every patient from Canada, though, but we will do what we have done, and for years and years, is taking these patients from everywhere in Canada, thanks to the expertise of our physicians and our researchers. And to finish, I think it's something that we have to see as an academic affiliation. So this is all about patient care, education, research, and there are some programs which are very new, actually, in cardiac surgery or cardiology, where the Newfoundland can have, with the collaboration of the Heart Institute, jumpstart into excellence right away. I give you one example that Dr. Ruel actually is an expert on, is minimally invasive coronary bypass surgery, which is the most frequent operation in heart surgery, where we do currently now, very often, in open heart surgery through a small incision, and I think it can be done here too. So there will be a transition, but like Premier was saying at the end, the goal is to have a world-class program here, and we'll be proud to have contributed to this. So thank you very much, and I'm very excited about the collaboration. Thank you very much.
Thank you, Dr. Mesana. I'm going to call now on Dr. Marc Ruel. He is the chair and head of the Division of Cardiac Surgery at the Ottawa Heart Institute. He's also the Pitfield Endowed Chair in Research in Cardiac Surgery at the University of Ottawa. I'll hand the podium over to you, sir.
Thank you very much, Minister, for the very kind introduction. I think this is a wonderful day. It's been very nicely summarized by Premier Furey, by Mr. Diamond, by Dr. Mesana already. This is not lip service. This is really all about patients of Newfoundland. It's about an agreement. It's about a partnership. It's about sister programs that have been working together for several years, and actually 2 years already in the making, with surgeons from my division and my beloved institute on site in Newfoundland, and growing together this quest for excellence that we have for not only all Canadians, but more specifically, cardiac patients of Newfoundland. And this is very, very palpable. I've been here now 6 times, and I can tell you, when I come to Eastern Health, when I come to Newfoundland, and I share with every team member this passion towards making Newfoundland patients well and giving them the very best cardiac health, this is what stimulates us to make this agreement reality. And it is now reality. And I want to thank everyone, including Premier Furey, Mr. Diamond, Dr. Connors, Dr. Mesana, who have worked very hard on making this agreement possible. I think it's great for patients for Newfoundland. It's also great for the Heart Institute. For my division, it is something that we strive to do. We like to find like minds, if you will, that want to create excellence in cardiac care and in cardiac surgery. This is very central to the mission of the Heart Institute. So this is wonderful chemistry in action, and it's all aimed towards making the patients in Newfoundland, our fellow Canadians, better and overcome their cardiac ailments. So thank you very much. We are so appreciative, and this is a great day. Thank you.
Thank you, Dr. Ruel. I'll now hand things over to Dr. Sean Connors, who is the Division Head of Cardiac Care in Eastern Health. Sean.
Premier Furey, Minister Haggie, I feel very humbled here today. Humbled for 2 reasons. First of all, to see the support of our government in the care of the heart patients of this province. But secondly, humbled for the privilege that it is to look after those patients with heart disease in this province. Fully 1 in every 3 people in this province are going to be affected by heart disease, so it's very likely that you or one of your loved ones is going to require care in our program. And like I do, I'm sure they do, they expect that care will be world class. that's what we want. It's what we want for ourselves. It's what we should want for our patients. And I've always said that we lead the country in terms of the burden of heart disease. So why not lead the country in terms of innovative approaches to that heart disease? You know, we're a small province, but we're smart, we're nimble, and we really care. I think that's what separates us from everybody else. Like, I really believe that we deliver world-class care. The partnership that you've heard about today will go a very long way to be able to integrate two heart teams to be able to deliver the care that patients will expect. Heart surgery is a complicated thing. Like, I'm a cardiologist, I'm not a surgeon, but what I know is that these are very highly skilled people. It's not just the physicians, it's our nurses, it's our intensive care physicians, it's our anaesthetists, and it's our perfusions. And if you're in a small place to gather all those highly trained people, and people around the country know how great Newfoundlanders are, they always have opportunities to move. So this integration, to me, allows us to expand and to enhance what we can offer our patients, and to provide a wonderful atmosphere for all our highly trained surgeons and other professionals, nurses and so on, to stay here and use the full scope of their skills looking after the patients that are their own family members here in this province. So it's very humbling, and I'm very grateful, Premier and Minister. I think this is a great day for cardiac care in Newfoundland.
Thank you, Dr. Connors, and thank you for all our speakers, Premier Furey, and our guests from away. This really allows me just to clue up today. I think this is a win for everybody, very clearly. It builds on a partnership that had existed in an informal way for some years, and now it formalizes it. It's a gain for the patients of this province, for the clinicians here, for research, and for the clinicians in Ottawa. We talk about collaborative teams in the context of primary care. Well, here's a different spin on a collaborative team that spans this country and benefits everybody involved. So with that, I'd like to clue up the live stream and the formal part of this. If media wish to ask questions of any of the participants, then they can see Laura Thomas or Megan McCabe. Once again, thank you very much for coming today.